So you don't have to get married or be in a relationship or actively trying to make a baby before you can start thinking of fertility evaluation or even your reproductive health. No. Even though we know that from our mid-30s, our fertility begins to decline so rapidly. But do you know that there are some women who are pretty younger, in their mid-20s, early 30s, who have comparatively similar diminishing ovarian reserve like that of older women in their 40s? I mean, mid 40s and late 40s. Yes, there are some women that we do recommend that they do, ovarian reserve testing to answer that fertility puzzle now because of their risk factors. For example, if you've had a previous ovarian surgery, like cystectomies in the past, you have endometrioma, endometriosis, you have some disease conditions like autoimmune disease conditions that can affect your ovarian reserve, you are on medical treatment like chemotherapy, or you have a strong family history of early menopause, or even environmental factors like smoking. Even some women who do not have any of these risk factors that are young, but they do have what we call early ovarian aging that could adversely affect their fertility. So in such clients, we do recommend that they do have ovarian reserve testing, but you could have diminished egg reserve, and that can, in that situation, address a lot of your concerns, and you could make sound reproductive choices in terms of when do I have to start my family. Do I start now looking at my ovarian reserve? Do I begin to think of fertility preservation? Do I begin to think of advanced fertility assessment? So that could make you solve that fertility puzzle. So if you find yourself in this situation, please, I do strongly recommend that you go for an ovarian reserve testing to check the quantity of your eggs in your egg basket. I still remain Dr. Nonny, Dr. Toquint. See you in my next video. Bye.